Hey everyone, how's it going? This is my 72-hour report since my knee surgery I had on Tuesday. So today is technically Saturday, so 24 hours from that point. A little bit after, but basically I wanted to just kind of give you a follow-up. Interesting day today. One of the best days actually since I actually had this surgery, and the reason is I actually was able to take a bath. I know that sounds really gross and disgusting, but truth be told, you start feeling really bad after the second day. So if you haven't been able to do anything by that point, you're probably going to understand what I'm talking about when I explain this right now. Was able to take a bath. I will be honest with you, very, very difficult. Not the easiest thing in the world to do. Obviously, as a shower, you can't stand because depending on the type of surgery you have, you can't put your foot any pressure on for most part. Some people can, and if you can, then just be careful. Make sure you put it on a no-slip surface. But if you can't, you're on one leg, or you're trying to sit down. The problem if you're sitting down is that you're now at an angle, and your foot can't have that little natural bend that it tries to have when they wrap it, from getting full extension. So then that causes a problem. So in reality, the only thing you can do is literally lay down in the bathtub and put your foot up over whether it's a small chair or whether some towels on the edge, something to that nature. I actually was able to use a small pillow and then prop my head as I laid down, a little small water pillow I was able to use as well to basically help me. I was able to do everything I needed to do. I even shaved, which I'm really happy about because I hate being unshaven, and cleaned up the mustache a little bit. But more importantly, I just feel really refreshed. And is a very important part. When you're not feeling well, your body's struggling. You're struggling. So the idea is you put yourself in a situation to try to do the best that you can. Sitting in a bed, laying down, what have you, for 7 days like I was requested to do, trust me, not a really exciting thing to do. In fact, one of the hardest things I probably have done, and I've done some interesting things in my life. But having said that, I do feel much better right now. And I actually did record right before I took my bath. I had to come up with some kind of way to figure out how not to get my leg wet, because it's one of the things they tell you. You cannot get it wet for 7 days you're dressing, which means no showers, no bath. Okay, so this is me getting ready to take a bath. And this is my, I don't know, what do you want to call it, plastic bag wrap around my brace so water doesn't come through. Hopefully it's going to work out, but we'll see what happens. Pretty much it's a Glad wrap bag with some tape around it, strapped to my leg, and we'll see what happens. And I will be honest with you, it's probably cutting the circulation off. I have it a little bit too tight, so you got to make sure you don't do it that tight, but I'll let you know how it goes. Seemed like it was okay because the foot was up, everything was good. As soon as I got up and I pushed it, all the water that I thought was pretty much blocked from the tape that I had around my leg somehow found its way inside, soaked up my entire foot, part of my brace area. Thank goodness my dressing was still dry because it happened quick enough to be able to get out of the bag and also to start to dry as much as I can. Unfortunately, just kind of show you real quick here, my brace is soaked. All of those individual pads, unfortunately, were drenched. Again, unfortunately, not the best way to go about trying to do it. The bag, if you can figure out another way, but all these individual ones I've had to take one by one off. They come off pretty simple, just like that. Make sure they're dry, as you can see, and again it's just the stuff underneath. So I have been able to do little flexing exercises back and forth like that, trying to put the knee up a little bit down, a little bit down. You don't want to do anything quick, you don't want to do anything fast, you don't want to rip any of the work that your surgeon's done. Trust me, they won't be happy with you. And again, because I'm part of an experimental surgery, I have to actually follow the directions. I actually signed a contract to do exactly what they say verbatim in order for me to continue on. So, and making sure that I do have that repair, outcome, which is pretty much in 3 months for a full repair, and I can be back in sports. So that is the idea behind what I'm doing. Everyone's going to be a little bit different. So that was my taking the bath experience. Hopefully take it for what it's worth, if it helps you or not. Finding a comfortable position before you get into the tub. You try to do it when you're in there. You have to get out, get some pillows, and get stuff. At least I had a few things trying to think ahead, like I try to do, so I'm not going to go ahead and be in more pain. A follow-up on a couple other things is that I haven't taken a pain pill, for about 8 hours, I think, 8 or 10 hours. And that's good because I'm not needing it. It's just kind of a consistent feeling. Obviously, you know, you're still going to be sore, you're still going to be tender, but at least you're not having those issues anymore. Typically, people are saying about 4 days, and then after 4 days, you should be okay as far as dealing with your pain meds. Some people need it longer, some people don't need it at all. Don't know how they can do it, to be honest with you. Having your leg cut open, taking a piece of your flesh is what happened to me. I had my hamstring removed to create my new ACL versus using a cadaver or versus using a different part of my body. It actually was the one right by the knee itself. So I had some very, very tender flesh and also muscles that are basically having to try to heal herself. So I was really kind of getting a little anxious because I wanted to start there. Obviously the process of physical therapy, doing what they say, stretching my leg, doing all these kind of different things. Yeah, that's not going to happen. I'm still just doing the foot exercises to keep the circulation going, put a little pressure, lift up here and down. And again, I did take off my brace. And so because of that,